Okay, it looks like we're live, so we'll get started. Welcome, everyone. It is Friday, April 24th, and thank you for joining us for this media briefing and update. Today, we will hear from Dr. Hsiu-Li Wang with an update from Public Health, as well as Regional Chair Karen Redman. Before we start, I just want to mention we've had some network connectivity problems. Should we not be able to complete the interviews in the briefing, you can simply follow up with me via email and I will help you get answers to your questions. Okay, so we will get started with an update from Dr. Hsiu-Li Wang. Go ahead.
Thank you, Julie. Good morning. I am very sad to report an additional 6 deaths since yesterday, for a total of 14 since Wednesday's briefing. All of these cases were residents of long-term care home and retirement homes over the age of 70. Very sadly, I expect to see an increase in deaths in these settings going forward. Some of these deaths were identified through posthumous testing. This is due to the fact that in these settings, we are testing people who have passed away, even when they have previously tested negative. The loss of a loved one is always painful, and our current situation has made grieving even more difficult. I wish to express my deepest condolences to the families, loved ones, and caregivers of those who have passed. There are currently 10 long-term care or retirement homes in outbreak. 7 facilities have had their outbreaks declared over. While more facilities coming out of outbreak is encouraging, I expect with the expanded testing, we will detect more cases in more homes, and more homes will go into outbreak. While community transmission has slowed, it is precisely because people are following the public health measures. We need to stay the course and continue to follow public health measures, including staying home, limiting trips in our community, practicing physical distancing when you are out, and washing your hands often. Now is not the time to relax these public health measures. Cases continue to be identified in vulnerable settings, such as long-term care facilities, retirement homes, and other congregate settings. I appreciate that this has been a difficult time for everyone. But by maintaining these public health measures, we are working to slow the spread in our community and protect those most vulnerable in our community. And by doing that, we will get through this together as a community. Your efforts are making a difference. Your efforts have helped to prevent our healthcare system from becoming overwhelmed and have helped prevent many more times the number of deaths we would have otherwise seen. Your efforts have helped ensure critical health services are available for those in need. Our challenge is not over. I thank you sincerely for your continued patience and perseverance.
Okay, I think that Dr. Wang is frozen. Is that the case for everyone? Yeah, okay. I think she made it to the end, so we will catch her again in questions and we'll move on to Regional Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. This continues to be a very difficult time for all of us, and we've lost more members of our community to the virus.
As we work you.
With my sincere sympathies go out to their family and friends who are dealing with these losses. While we're beginning to see positive effects of our physical distancing efforts, COVID-19 cases and deaths continue to increase in our long-term care homes and other congregate settings. I want to send encouragement and acknowledge the hard work and the sacrifice of the frontline workers at these facilities. And I'm grateful for the collaboration and the support with our local healthcare system. Together, we will get these outbreaks under control. As the holy month of Ramadan begins in Waterloo Region, I realize that celebrating will be very different this year. I'm sure the inability to pray together and to celebrate as a community will be keenly felt. However, it is still very important to continue to practice physical distancing, and I encourage those who celebrate to connect with family and friends virtually. No one wants this community to return to normal more than I do. I think we're all anxious to get back to our familiar lives. We have to do it safely, and we have to let our strong team of medical advisors guide us. Although all of your physical distancing efforts are showing some success, now is not the time to let up on our efforts. Before we take the next steps, we need to have a better control over the virus in our community. While community leaders are beginning to plan for a time when we can return to normal, the delicate balance between relaxing physical distancing measures and continuing to slow the spread of the virus in the community, especially in our long-term care settings, have to be weighed very carefully. It is our collective responsibility to protect our citizens, our essential workers, and to keep them safe. I would like to remind everyone that under the provincial emergency order, gatherings of more than 5 people are banned. I know this has been an exceptionally anxious and stressful time for everyone, and we all cope with stress differently. Personally, I try to find time each day to connect with family, especially my grandchildren, and to try to get outside for a walk or to think of something that I'm grateful for. If you're feeling overwhelmed, please reach out through the community resources available to you by phone or online. There are resources on the public health section of the region's website. The Canadian Mental Health Association for Waterloo Wellington has also launched a new website at hereforhelp.ca that has useful tools and techniques to manage the stresses of dealing with COVID-19. If you know anyone who is in crisis or who needs service, please direct them to 1-844-HERE-24/7. And please remember that we're all in this together, and many of us are likely feeling the same way you are about the situation. You're not alone. Thank you again for limiting the times you leave your house, the creative ways you have found to celebrate birthdays, anniversaries, and milestones, for changing the way you celebrate religious holidays, for supporting our frontline workers, and for keeping everyone safe. Hang in there. Together, we've got this. Thank you, Julie.
Okay, thank you to both our speakers. I also want to mention that CAO Mike Murray is with us today, not to provide an update, but to answer any questions that you may have. And with that, we will turn over to questions now. So when I call on you, you can unmute your mic and ask your questions. And we will begin with Tim from 570. Go ahead, Tim.
Yeah, can you hear me? Yeah, my question is about long-term care facilities. Has it been a challenge to discuss this information with the family members that aren't allowed to get access to seeing their loved ones?
So thanks for the question, Tim. So it is the homes who are reaching out to the families. And what I understand from them is, yes, it has been difficult. You know, the distance that the families have to maintain, not being able to be with their loved ones, has been quite difficult.
Okay, and are there going to be having more additional measures to these long-term care facilities, or the ones that are in place, is that helping or working for you?
Yeah, so you know, over the last number of weeks, there have been additional measures that have been put in place, including provincial directives that have come down from the ministry to the long-term care homes. And we have been continuing to support these homes in terms of understanding what these directives mean and implementing in as they come in. You know, right now, the long-term care homes are under very strict measures. But one of the phenomenons that we see is this lag time between when somebody becomes infected and then develops symptoms and then potentially, for example, passes away. So we know, for example, that it can take up to 14 days between the time when somebody becomes infected to when they start to have symptoms. And then it can take several days after that before, for example, they pass away. So there is always this lag time between when measures go in place and we start to see the effects of these. You know, we have had a lot of people in our long-term care homes have the infection, and so that's why I think we will continue to see you know, unfortunately, deaths rise as a result. One of the things that we are in the process of implementing is widespread testing of long-term care homes and retirement homes going in priority order, right? For example, those homes that are in outbreak now. This is another step that will allow us to better assess the status of the homes, because what we are finding now, including with some of those that have recently passed, is that people who have tested asymptomatic can sometimes come back later positive, but we only know that when we do the tests after they passed away. So it's a very challenging situation in terms of, you know, all the testing that's going on the results that are coming in. But that additional testing is going to give us an even better idea. And right now, what is happening is that the measures that are being recommended are the best measures possible.
That's great. Thank you.
Okay, we'll go to Joanna next from the record. Go ahead, Joanna.
Hi, thank you. Dr. Wang, you just mentioned it briefly, but why is it important to test these long-term care home residents who have passed away to see if they had COVID?
We need to have a better understanding of how COVID spreads in these settings. And, you know, that's another way for us to understand what has happened. You know, it's not something that is done routinely, but in the case of COVID and in the case of outbreaks in these settings, this is an additional testing measure to ensure that we have captured all the deaths that have been related to COVID. And some of that testing will be, some of the results of that testing will be naturally delayed. Because, you know, there's a lot of tests that are going into the labs now, and, you know, tests for people that are symptomatic, you know, those are going to be prioritized over tests of people that have, for example, passed away. So we might see this a little bit of a lag in terms of when tests for those people who have passed away come back to us, and then we can see, then we'll see numbers get added because their tests will come back positive a little later. So that's why sometimes we can see these jumps in deaths because of reporting of people who have already passed and whose results have now come in.
Mm-hmm. And so these people who were tested after they died, would they have not been symptomatic then?
Mm-hmm. It's possible, yeah.
Okay. Or they could have had symptoms, but it wasn't clear that it was this.
Yeah. Oftentimes what we were seeing is people, you know, they were tested, they were asymptomatic. And then the day that they pass away, they start to have symptoms. That's often what we see, and then they've passed the same day. So you know, we do a test, and then we often find out that they actually did have COVID, but they were asymptomatic before and negative before.
Right. And then just another question about Trinity Village. Has there been anything more done there regarding their outbreak?
Yeah, so there's going to be expanded testing at Trinity.
Mhm.
And the Waterloo Wellington Health System Response Team has been in daily contact with them in one way or another, calls or emails. So we're continuing to support them very closely. Yeah.
All right, those were my questions for now. Thank you.
Thanks, Joanna. We'll move on to Damon from Woolwich Observer. Go ahead, Damon.
Hi. To start off, I was wondering if Dr. Wang could address the additional outbreak at St. Mary's General Hospital and provide any information on that.
Yeah, so it's similar to what happened previously when they detected clusters of cases on 2 other units in their hospital. It's the same situation. Through their surveillance system, which is always ongoing, they detected another small cluster of cases on this additional unit, and they contacted us, and we discussed the situation. We determined this is similar to what was happening on the other units, and so it was important to also identify this ward as being in outbreak and to put in place additional measures. So, you know, St. Mary's is working hard to implement all the measures that are required, and they're continuing to keep us posted.
Okay, thank you. And then my next question is about the post-humanist updates.
Mhm.
When did those tests begin? And how much of a spike should we see in the coming weeks
Mhm.
correlating these results in testing?
So we've been doing that for homes that have been in outbreak to date. And it's difficult to know. In fact, it's not possible to know, you know, when we will get more cases. But you know, I expect that we will see more cases just because of the number of people who have the infection, and the fact that we're also going to continue to test people even when they're asymptomatic. So we're going to do even further testing, and that will likely reveal more cases. And then, you know, the deaths are kind of unexpected. You never know when that might happen. But then if someone has passed away and they were previously asymptomatic and or previously negative, we test them as well. And then usually a number of days later, we'll get the results on them. So it will be variable.
Okay, so with the dashboard then, those people that have passed, they will be on there as COVID related?
Yes.
Okay, perfect. That's all my questions for today. Thank you.
Any death that in which COVID was at least a contributing factor will be counted. So even if, for example, somebody had died of something else, right, primarily, but they also had COVID, or they were also diagnosed with COVID, they will be counted.
Okay, thank you.
Okay, thank you, Damon. We'll move on now to Nicole from CTV. Go ahead, Nicole.
Hi, good morning. Give me 1 second here. Rivera officials yesterday said 23 of the 40 residents had been transferred. Do you have any updates or additional measures being added to the action plan at Forest Heights?
Yeah, no, thanks for the question, Nicole. So the purpose of the approximately 40, which was the approximate number when the plan was started, was to ensure that there would be 68 places that were freed up in the home, because they have other spaces that are also, you know, in the process of being freed up. And so as the situation evolved over the next couple of days from when they started on Monday, they ended up freeing up a total of 62 out of 68. And I understand that that number's likely going to climb again. So likely going to, you know, be even closer to the original 68. So so that even though the number of people that we thought needed to be moved out of the residence was higher, currently, because they are very close or they're approaching the original goal in terms of, making sure that there's, the 4 resident rooms would become 2 resident rooms, that kind of thing. It's not the total number that need to be moved out that's important. It's the number of spaces that have been freed up that is important. So they are definitely making progress on that plan. And the hospitals, have been taking in the additional patients as needed. And this is an evolving situation. We continue to check in along with all the health system partners and the hospitals daily on the Forest Heights situation, including, with our senior folks from Rivera to get an update on the implementation of the plan. And so, they're continuing to progress. And it's very likely that the total number that need to be transferred out of the home won't approach 40, but be closer to what's happened to date, which is, I believe, 23. Just because the overall goal was to just free up space, yeah.
Okay, and the difficulty in this is that the number of spaces being freed up are as a result of the unfortunate passing of these residents, correct?
It's not always the case. Sometimes we have families that have taken their loved ones out of the home. But yes, if someone has passed away, yes, that's another reason that spaces.
Do you know how many people have taken loved ones out of that home?
I don't know, but I know I don't know that number. Rivera would know that number.
Okay. Second question that I have is, what is the procedure for working with companies like Conestoga Meats and Breslau in order to determine the extent of exposure when multiple employees are infected at a workplace?
So that's a good question, Nicole. Thank you. So we are in the process of investigating the situation at Conestoga Meats. There are cases in our region as well as outside our region. And we are also working with the CFIA, which is the agency that provides oversight for this clinic. I'm sorry, not this clinic. I'm sorry, for this plant, as well as the Ministry of Labor, because we have received concerns and calls, anonymous ones mostly, and so we are following up, working with the Ministry of Labor, in addition to the CFIA, which oversees the plant. There's a CFIA inspector, for example, at the plant every day. So we're continuing this investigation, and it's an important thing that we look into. We know that there are a number of community cases. We understand that they have been implementing all the recommended measures in terms of what has been recommended by public health authorities and the CFIA or any other body that they are accountable to. But at the same time, we're continuing to investigate.
Okay, one last question. Of the 216 resolved cases, are you able to track, or are there any numbers in terms of how many of them come from long-term care facilities?
We haven't been able to break down the data that way yet. We have a lot of work on data that we're trying to, make sure we keep up to date on. So we haven't broken it down. But, we do know that there are people in long-term care homes that are recovering. It just, I don't have that data for you now.
Okay, that's it. Thank you.
Okay, thank you, Nicole. We'll move on to Paula from CBC. Hi, Paula.
Hi. So further to the long-term care discussion, does the fact that we've seen multiple deaths coming in overnight at long-term care homes in recent days, does that signal to you that we have not yet hit the peak of this pandemic in our region?
Yes, the number of cases and the number of deaths signaled that it's likely going to continue for a while. We don't know how long at this time. But, you know, I do think that we're still on the upswing of the situation in long-term care homes and retirement homes. But that said, there are homes, as we've seen, that, you know, that are coming out of outbreak quickly, you know, where the spread has not progressed further. So there's not a uniform picture amongst long-term care homes and retirement homes. But overall, you know, due to the number of people who have been infected, including those who have died, yes, it's still a very serious situation. And we're still in a period of increasing cases. And I think that we're going to find even more cases with the expanded testing.
Mhm. And my second question, you mentioned that some family members have made the move to take their loved ones out of long-term care. What should families consider when making that decision?
As I mentioned before, this is a very personal decision by families, you know, and what we're trying to do is, for example, through our dashboard, is to keep them the most up-to-date possible on what's going on to inform their decision. I understand, you know, there's also families that have decided they do not want to remove their loved ones from homes. And so it's a very personal decision.
So it's up to them, basically?
Yes.
And then just finally, I know obviously hindsight is always 2020 in these situations, but do you have any regrets about the way the health system has handled COVID in our long-term care homes?
Yeah, I think there will be time to look at this more carefully and better. And I hope that we do. I think the spread in the long-term care homes has been worse than what we anticipated. And so that's something we need to look at very closely. You know, as we are working with these homes and as the health system partners across multiple sectors are now working together to try to support these homes, you know, what we see is we are working to support issues that existed before COVID-19. There were system issues like staffing issues that were exacerbated by COVID-19. And so, you know, health system partners are, especially here in this region, I understand, you know, we're known for that, and we've demonstrated that everyone's willing to pitch in. But there were system issues, and after we get through this crisis, we have to look at those carefully.
Thank you.
Okay, thank you, Paula. Last, we have Kevin from Global. Go ahead, Kevin.
Hi, I'm just wondering, I know obviously things aren't looking good in long-term care homes, but they've started to improve elsewhere. What conditions will you guys consider before you lift some of the recommendations and/or the state of emergency?
Well, Mike, I think might talk a bit more about that.
Yeah, so maybe I'll make a comment on that, and you're probably going to get a similar answer, Kevin, to the one that I think Chair Redman and Dr. Wang and I have provided over the last week or so, which is I think it's still too early to tell exactly what the sort of recovery and reopening phase is going to look like. You know, the province has been quite directive over the last, 6 to 8 weeks. And one of the things that we really need to wait and see is how directive is the province going to be on the reopening and recovery phase. It's possible they'd be quite directive and essentially will follow their directions. On the other hand, it's also possible they may be a little more permissive and say, okay, here's some general guidelines, local municipalities make your own decisions. We really don't have any idea yet what that's going to look like. I heard an interesting expression this morning about, the recovery phase, and somebody said, this is like driving down a foggy road at night with no headlights. And I thought that's an interesting image for what the next phase is going to look like. I think Chair Redman wants to add.
Thanks, Mike. I guess only to add to Mike's comments, and I totally agree with them, is that people of Waterloo Region should rest assured that these conversations are going on, that thoughtful plans are being put in place, but always with a view to following our excellent medical advice that we're getting from the local public health, our public health partners, as well as from the province. Conversations are going on, but this needs to be done proportionately and gradually. And as I said in my comments, there is a balance between continuing to practice physical distancing, because we know that it's demonstrated that it has worked, and when we can all get back to normal. And we can't, that we have to do it in a thoughtful way, but those conversations are going, the collaboration is definitely a daily occurrence.
Okay, thank you. In terms of the posthumous count, how much would the lag be between when the person passed and when you would have gotten the numbers from the testing?
It's variable, and it depends on lab testing capacity, which has greatly improved, right, over the last couple of weeks. But at the same time, there's a lot more lab tests that are going into the labs. So I know the public health lab system in Ontario is working extremely hard to process samples as quickly as possible. But as I think I mentioned a little earlier, the tests will be prioritized based on the need, and sometimes the tests on those who have passed will take a little longer than on those who are symptomatic, for example, because we need to know those results a little faster. So it can be delayed by a number of days, and then it can kind of come in all at once. So yeah, it's very variable. It's not really possible to predict at this time, but I would say, it can be a number of days.
So is the testing similar across the province in terms of?
Yes, it could be. Recently, the coroner released guidelines, and the provincial coroner released guidelines on how we should be classifying deaths that have occurred in homes, where there's been COVID. And here in Waterloo Region, we have been following those guidelines all along, even before we had them. So we were in line with those guidelines already. I would say that over time it should be consistent over the province at least.
Okay, thanks everybody, appreciate it.
Thanks.
Thank you, Kevin. Are there any last questions that anyone has? Nicole, I see your hand up. Go ahead.
When did the testing of someone who passed away begin?
Mm-hmm. So we started doing that when we started having outbreaks in Waterloo Region.
Is that now a guideline that was issued by the coroner?
Yes.
When did that guidance come down from the coroner?
A day or two ago. I can't remember now. My inbox is very busy. That said, public health units generally always count deaths in an outbreak setting in a home, even in previous years when it was just flu or other respiratory illnesses, when there is at least some association with the patient's condition, even if it wasn't their primary cause of death. So it's been a typical way to classify deaths. But what's been different in COVID-19 is now we are also testing people who have passed away, who were previously negative or asymptomatic. So that's been the additional thing that's happened with COVID. And, that's what that's the additional thing. And so there's going to be, more deaths that are counted because of that. Or at least there's going to be the right amount of deaths that are counted because of that, I should say.
Okay, any other questions? All right, I see none. So thank you all for joining us again today and for sticking with us through this time. I wish you all a safe and healthy weekend of physical distancing and being well. This concludes our media briefing for today. Take care.